Ladies and gentlemen, good afternoon. I am Dr. Maria Burns, Director of the Technology Leadership and Innovation Management Program of the University of Houston here in Texas, USA. I'm delighted and honored to present my paper titled Proactive Health Policy Framework for Cancer Prevention, a comparative analysis of global regulatory approaches and community implementation strategies. This research presents a systematic policy analysis of cancer prevention strategies across the US, the EU, and the United Nations, using mixed methods approaches, including policy document analysis and computational database examination. The study reveals significant regulatory disparities while identifying methodological challenges in comparative health policy research that constitute important findings about global health governance capacity. While examining the impact of regulations and community networks on the health and socioeconomics of cancer treatment, this paper will reveal how proactive policies integrating artificial intelligence-driven risk assessment methods on one hand, and emotionally intelligent community engagement on the other hand. This synergy will help cancer prevention at a global level. Another component of this paper has to do with epigenetics. In the past 20 years, numerous research papers verify that epigenetics comprise over 90% of cancer causes, and definitely epigenetics can help alleviate the staggering numbers of new cancer cases. There are several concerning elements pertaining to future cancer projections. The exponential projected growth of new cancer cases globally from 20 million cases in 2022 to 35 at least million cases by 2050. That is a 77% increase. Now consider the consequences at a social level, personal level, but also government level, the healthcare system, the financial system, how families will be able to find the resources to tackle this disease. These are many components that are discussed in this paper. In the US, from $1.16 trillion annual costs in 2022, there have been $1.25 trillion in 2025. So that is an 8% increase in just 3 years. At a global level, $25.2 trillion, that is the projected global cost of cancer from 2020 to 2050, representing 0.55% of the global GDP. Based on these numbers, the cost trajectory is unsustainable for families, nations, the healthcare system, employers, and we need to do something about it. Let us look at the reactive healthcare system. There have been many efforts from national healthcare systems in the US, Europe, and many other regions in the world to break the reactive healthcare pattern. As we can see in the diagram, when the official priority is a reactive treatment, or it may have to do with resource limitations, maybe social factors, maybe demographic factors, communities being in isolated areas and so forth. So whatever the reason is, this will lead to increasing healthcare costs, limited funds to be reimbursed by government health insurance, but also a lot of burden to the patients and their families. As the statistics rise, doctors and medical personnel get overworked. In the past 20 years, there have been many research papers positing that 90 to 95% of cases, cancer cases, are caused by external factors, epigenetics. So that is environment, lifestyle, for example, diet, infections, smoking, environmental pollution, and so forth. On the other hand, only 5 to 10% of the cases are caused by internal factors. So we're talking about inherited mutations of the cancer cell, immune conditions, hormones, and so forth. In the recent years, there is an impressive global bibliography showing that improving our lifestyle through epigenetic interventions, cancer patients remain in remission. There have been miraculous radical remission cases that merit further study and knowledge transfer of these best practices. So we can define epigenetics as the study of the changes in gene expression that are not hereditary and do not involve changes in the DNA sequence. It focuses on changes due to environment and lifestyle. And here we have the three-step process of carcinogenesis involving, first, the initiation. That is the carcinogenic initiator leading to unrepaired DNA damage. Second, the promotion. That is the tumor promoter involving clonal expression of preneoplastic lesions, that is cell multiplication. The genomic instability converts the benign tumors into malignant tumors. Finally, the progression of genetic change leads to clinical cancer diagnosis, which over time and under a certain environment may lead to metastasis. And now we can see the hope, the light at the end of the tunnel, epigenetic prevention. Through exercise, healthy diet, stress reduction, environmental integrity. This can help break the vicious cycle of cancer by prolonging life or saving one's life. This is huge. Epigenetic regulates how genes are turned on and off without changing the DNA itself. Lifestyle factors like nutrition, exercise, and so forth may change the way that cancer disease progresses. By optimizing these influences, we can reduce cancer risk and slow the progression. This table demonstrates how epigenetic mechanisms can modify the DNA for humans and other mammals. Negative epigenetic changes promote carcinogenic gene activation, invasion, and activation of metastatic pathways. Negative epigenetics alter methylation. They include hypermethylation of tumor suppressors. That is an unhealthy lifestyle, which silences the body's methylation maintenance. Next, we have promotion, chromatin remodeling. It increases histone deacetylase, HDAC activity, which contributes to gene silencing. Stress alters stress-responsive genes. Pollution alters hormone-responsive genes, and so forth. Next, the stage of progression, metastatic epigenetic reprogramming. DNA methylation, histone modifications, and changes to higher-order chromatin structure play a central role in the regulation of mammalian genome organization. Methylation is the chemical modification of DNA and other molecules that can be retained as cells divide to generate more cells. Methylation groups, which are one category of chemical tags, can switch a gene on and off. In this sense, they can alter gene expression and modulate transcription of genetic information from DNA to RNA. In this manner, they can influence the expression of any given phenotype or disease. DNA methylation protects the genome's integrity by restricting the activity of transposable elements, TEs. These comprise repetitive genetic sequences that can move to new chromosome positions in the body using either the removal and insertion method, so cut-paste, or replication and insertion, copy-paste method. One pivotal conclusion of this paper is the positive effects in cancer patients when promoting a lifestyle of positive epigenetics. To meet the objectives of this paper, Let us examine the research questions. How do state and national regulations translate into applied cancer prevention outcomes? What is the role of regulations in the effectiveness of cancer prevention? How can global synergies improve cancer prevention strategies? And then, of course, we're using a mixed methods approach, policy analysis across the US, EU, and UN jurisdictions. Regulatory database using RStudio and Python. Historic event modeling with interrupted time series analysis. And of course, the conclusion of this paper focuses on the integration of emotional intelligence with artificial intelligence for best results, not only in data collection, data analysis, primary data, but at the same time conveying a message to communities. Legal comparisons between the US, the EU, and UN jurisdictions. In the European Union, in the 1980s, we had the mad cow disease, which greatly inspired a more rigorous legislation, or let's say a proactive stance. This inspired the General Food Law based on the precautionary principle where policymakers can act even with inconclusive scientific evidence. The precautionary principle, Article 191 of the Treaty of the Functioning of the EU, allows a proactive, speedy response for humans and animal health and environmental protection. This includes a cost-benefit analysis of proactiveness versus delayed action versus lack of action. In short, in Europe, it is assumed that a substance is harmful unless proven safe. On the other hand, in the past years, until the beginning of 2024, there was an opposite assumption that food or other substances were safe until proven harmful. FDA's law, dated back in 1958, started this generally recognized as safe principle. So we had 3,000 at least GRAS substances where the food industry can bypass FDA's approved protocols. I'm delighted to mention that from early 2024, this has changed radically, and there are more slides in this presentation to show that. Finally, with the UN, we understand that they don't have a legal jurisdiction. What they can do is they can coordinate global health governance. They can set the international standards, but then it's up to the member states to either adapt these protocols or edit, revise, and adapt, or reject. As you can see, in the European Union, there are approximately 316 approved food additives, and there is a pre-market prevention and post-market evaluation protocol. On the other hand, up to early 2024, in America, we had 10,000 approved food additives, so you can compare the number, it's vast, big difference. There was limited pre-market evaluation. So for new companies or new products that would launch food additives or other substances in the manufacturing of foods, there was very limited pre-market evaluation. Fortunately, this is changing big time. We're thrilled about it. In the UN, we have several thousand food additives, but these are grouped by function. So we have antioxidant family, acidity, pH regulators family, humidity control family, gelling agents family, and so forth. And in this slide, you can see the comparison because since the beginning of 2024, the US is adopting a more proactive stance when it comes to stopping the safe until proven harmful assumption, We have new rules to eliminate the GRAS legal loophole, and many protocols that until recently have been voluntary, now they're mandatory. So manufacturers should notify the FDA and the public about any new chemicals, new substances in the food industry, health-related, and so forth. In addition to the policy framework, it is important for us to analyze the actual cancer statistics by country, per capita. What are the cancer diagnosis rates? What is the mortality? For this paper, I have used numerous data sets from countries, from the European Union, the World Health Organization, and so forth. For the sake of time management, let me just present this diagram, which comes from United Nations sources, showing that developed economies like the US, Canada, Australia, Northern Europe encounter higher cancer rates per capita. However, there is a twist to the story, because this diagram shows there is no positive correlation or statistical consistency between cancer diagnosis rates and the cancer mortality rates. So as you can see in this global map, countries like China, which although they have a lower cancer diagnosis rate, they have a much higher cancer mortality rate. On the other hand, in the US, Russia, Northern Europe, we have higher than normal cancer diagnosis rates, but lower mortality rates. There are many reasons for this disparity, which I analyze in this paper, and I'm conducting rigorous research to evaluate this because this is important. Another important component for data scientists, every time we are working with large or very large data sets, we may have to improve certain discrepancies that are found in data. With all these very large data sets for this paper, I had to overcome certain challenges which are discussed in detail in the paper. Finally, we need to create a conclusion on best practices for synergistic prevention between the use of artificial intelligence and emotional intelligence. The artificial intelligence strengths that we can bring into the paper, which we can bring to the table for cancer prevention and policy analysis purposes, include big data comparison modeling, future trends, real-time monitoring, precision risk assessment, so we can check genetics versus epigenetics, but at the same time, predictive policy modeling. On the other hand, we can use emotional intelligence for one-on-one discussions with patients, community trust building, participatory community information exchange to gather certain demographic information that large impersonal data sets may not be able to provide. We can use complex artificial machine learning outputs to create actionable community health notifications. And then we can strengthen social cohesion and peer support systems that artificial intelligence cannot replicate. Ladies and gentlemen, this is the end of my presentation.